Just 2 weeks ago, Mason Howard was a healthy 10-year-old boy living in a popular tourist destination. Today, he's at UC Davis Children's Hospital in Sacramento, fighting a rare disease believed to be associated with COVID. And his father, back in South Lake Tahoe, is fighting another battle.
People should think twice about packing their family in the camper and coming up here because I don't think it's that safe.
Mason has tested negative for COVID, but doctors tell the family his symptoms point toward multi-system inflammatory syndrome, or MIS-C. It's an illness so new the CDC says they don't yet know what causes it. But many children with MIS-C had the virus that causes COVID-19, or has been around someone else with COVID-19.
He had a fever, he wasn't feeling good, he started vomiting, he had some diarrhea. Quickly he was showing multiple symptoms for something obviously really bad, and immediately you start thinking of COVID.
Corley Howard says his family was very careful to social distance even before his son got sick, and it's mostly because of this, the steady stream of traffic they see coming into this region almost daily. He says local leaders need to do more about it.
We're definitely seeing an influx of people, and we're keeping a close eye on that.
City Manager Joe Irvin says South Lake Tahoe is working closely with county health officials and following their recommended guidelines. He says they're doing all they can.
I think even above and beyond. We have the ambassador program. We're doing things that we can do within our parameters.
At the same time, South Lake Tahoe continues to report about half of the county's COVID cases, despite being less than 20% of its population, leaving Corley Howard to wonder why people are still allowed to come in the middle of a pandemic.
The timing's not right. It's more crowded right now this summer than it has been in a long time.
South Lake Tahoe city officials say the town's normal population is about 25,000, but it swells to more than 100,000 on busy summer weekends.